Welcome to All Things Simplified. Today we will discuss location of pulmonic stenosis murmur using our knowledge of anatomy and pathophysiology. Pulmonic stenosis is narrowing of the pulmonic valve, restricting blood flow from right ventricle to pulmonary artery, or in other words, restricting blood flow from the heart to the lungs. Due to a stenotic valve, the right ventricle has to work even harder to push blood into the lungs, leading to right ventricular hypertrophy, also known as growth of muscle, as to where one will auscultate for pulmonic stenosis murmur. Think about bursting through a stiff door, an action done in systole, contraction. Your momentum keeps propelling until you come to a full stop. Hence why pulmonic stenosis murmur is heard at the left upper sternal border and radiates to left shoulder or neck region. There is also a wide split S2, that's your pulmonic and aortic valve, due to delayed P2, that is pulmonic valve. Status post-disease state causing delay blood flow through pulmonic valve, while aortic valve is carrying out its normal function. Why does the heart murmur gets louder with inspiration, one may ask? As you know, there is pressure between the parietal aka chest wall and visceral pleural cavity aka lung. That space allows for expansion and collapse of the lungs. The pressure in the thoracic cavity also indirectly affects heart. With inspiration, intrathoracic pressure is negative. A negative intrathoracic pressure decreases compression around the lungs, allowing for expansion. A negative intrathoracic pressure also decreases compression around the heart, including right atrium, intrathoracic vein superior vena cava, and inferior vena cava as they enter the chest, allowing for blood to flow to the heart. An increase in blood flow produces murmur, hence why pulmonic stenosis becomes louder with inspiration. Let's bring anatomy into our focus. When a person exhales, the intrathoracic pressure increases, compressing the lungs and heart. That compression is acting like a tourniquet. There will be no effective venous blood flow back to the heart. Blood flow is needed for production of murmur. Left upper sternal border systolic ejection murmur, increase with inspiration and wide split S2, think pulmonic stenosis.